Wow, that pause there. Why don't you go ahead?
All right, let's do it. Tougher quarantine restrictions are in effect starting today in the UK.
Yeah, the measures aim to prevent the spread of new variants from abroad. Joining us live to talk about the latest surrounding COVID-19 is internal medicine specialist Dr. Abha. Good to see you. Great to see you this morning, Doc.
Well, good morning and happy birthday, Mr. Avery.
Thank you very
Nice.
much. Appreciate that.
So let's dive right in. Let's talk about this new variant coming out of the UK. Is it more contagious, more dangerous? What do we know about it so far?
Yeah, thank you for the question and good morning. Thank you for having me. Absolutely. The B117, as it has been, come to know, is more contagious and possibly more deadly because it is more contagious. It became sort of recognized in the UK as far back as September and probably entered the United States in December of last year. There are reports that it could become the dominant virus strain here in the United States, or variant, forgive me, in March of this year. What that means is we cannot let our guard down. We must maintain our intensity with regards to non-pharmaceutical interventions that we've been touting since the beginning, wearing a properly fitted mask, distancing by at least 6 feet, and limiting your indoor gatherings.
So, Doctor, what is your take on the vaccines that are available to kind of combat that new variant? I've heard that the Pfizer and Moderna, they can actually tweak that a little bit to make it kind of attack it more. Is that true?
Absolutely. Now that the technology is already out there, Mr. Avery, I think we have an incredible opportunity, much as we do with the flu vaccination every single season, to tweak our currently available vaccines the globe over so as to adjust to variations or mutations in this virus. This virus, like any virus, is smart in that it wants to survive. So minor mutations that it feels could escape detection and or elude vaccines, scientists have the capacity to meet those behaviors, if you will, and tweak vaccines so as to meet the needs of minor variations in, say, that S spike protein that binds to our cells.
And doctor, you said with this new variant, it's important to remember to social distance, wear a mask, of course, and now is not the time to get comfortable and forget. What do you think about double masking and how effective is that against this new variant?
Isn't it fascinating when back in March, we were told don't mask because in large part, we wanted to make sure there were masks and proper PPE available for the people working on the inside of this pandemic. And now we're saying everybody needs a mask. It needs to be a well-fitted, snug mask, one that fits over the nasal bridge tightly, fits around the face snugly, such that when you're speaking, you can feel that mask move forward and back, right? And you can feel warm air against your face. So number one, you want a snugly fitted mask. Now, a double mask. If you're going to wear 2 masks, you don't want 2 flimsy masks both escaping your nose. You want one tightly fitted surgical mask over your face, your nose, and the extent of your face, and then a cloth mask overlay. Now, a cloth mask that's optimal is one that, when held up to the light, will not permit light to penetrate through that mask. I've had patients coming into my clinic with flimsy masks that ride well below the nose, A, because they've been worn all pandemic long, or B, because they were too big to begin with. And I've instructed many of my personnel to just hand them a well-fitted surgical mask when they come to the desk. There's no point in wearing a mask that isn't snugly fitted and covering the bridge of your nose where defending against particle and aerosolization is concerned.
Very good. Dr. Abha, good to see you. Thanks for being with us this morning.
Always a pleasure. Thank you for having me.